I believe we can learn a lot from each other.
We plan to collaborate in a multi-country level.
Nutrition also have another important meaning. It's not only just for health.
Remember, exercise is king, nutrition is queen. Put them together, you've got a kingdom.
When you're chronically coughing, it's very embarrassed. So you start to not want to drink, you start to not want to eat.
The result is being attributed by the consumption in plant protein, viscous fiber, and nuts.
I'm also excited to have invited so many renowned scholars. The theme of this conference is to highlight the value of nutrition and its application in geriatrics and long-term care. I believe we can learn a lot from each other and gain many research and practical insights over these 2 days. Through comprehensive discussions over these 2 days, I believe we can advance our knowledge about nutrition's role in disease prevention, improve quality of life for our aging population, and also promote healthy longevity.
We have a long-term collaboration or friendship between Japan and Taiwan. Professor Shi and Professor Sean and us, a group, had a long-term collaboration on healthy aging and published several papers. And we also have a long-term collaboration with other group in Taiwan, Professor Chen Langong. And we have also published several papers on healthy aging and longevity. So the purpose of the collaboration is to just pool or combine 2 cohort data.
Facing rapid aging, and also we have a very comprehensive healthcare system, but without further refinement, people are worried that the aging society may overwhelm the whole system. So we need to figure out new way. So I think the major theme of this conference, healthy aging, is the key word, because aging not necessarily need to increase the medical care. If we can figure out some way to have a healthier aging, and then create a new kind of work opportunities.
But I think it's also a field that we could invest some of our knowledge and time to be developing. Appetite loss is, for me, potentially an early marker of declines in function in ovary. The extent to which it may also be a marker of accelerated biological aging is currently being investigated, and I'm quite sure that in the near future we will have very, very nice data on the biology of the interplay between the biology of appetite and the biology of aging, and to try to disentangle some of the questions that we have on this topic.
How about future research? Well, there are many gaps, more questions than answers. I think that's a good thing. It means that all of us in this room, there's potential for us to look deeper into this area. This includes the optimal source and dose of protein intake, safe and sustainable strategies for caloric restrictions. I mentioned about time-restricted feeding. Sex differences possibly as well in the response. So this very interesting study showing that protein intake in women in the Mrs. Health study actually reduces the risk of frailty. And last but not least, right, compliance is really like that thing that all of us are really looking at, right? What can improve compliance? That holy grail that needs to be answered. So social, cultural, and behavioral factors, technology may be as enablers to promote adherence in the real-world implementation.
I show you 3 lessons learned from the study that the virtual ICO can be implemented in the rural area in Thailand. And we also done the nutrition education plus home exercise to reverse frailty in urban communities. And the protein-based 4NS show some benefit in malnourished or poor patient in genetic clinic. And the last one, nutrition and exercise, is the way to gain a kingdom.
And what about nutrition effect? What happened to the diet? And actually, we observe about half a serving of protein food. We observe about 1/3 the piece of increase in terms of fruit, and also 60 cc of milk increase, and 1.5 tablespoon increase in nuts and seeds. So the change is really not too big for every fruit group, but if you add them together, it probably creates about 1 and 5 servings of protein a day. It translates into somewhere more than 10 to 15 grams of protein a day.
Our findings suggest the pleiotropic neuroprotective effects of tachyolin. First, tachyolin prevents the aggregation of amyloid beta. Second, tachyolin exerts anti-inflammatory effects in microglia. Finally, tachyolin has potent antioxidant effects. These pleiotropic effects lead to the suppression of neuronal injury and cerebrovascular dysfunction, thereby contribute to the suppression of cognitive impairment. So we can suggest that pleiotropic effects of taxolin may contribute to prevent dementia in patients with diabetes.
So in summary, maintaining a stable high diet quality trajectory over time is associated with a better cognitive performance as compared to the other two trajectories. So targeted interventions on food component will be helped to promote and sustain a better diet quality over time and may have a substantial impact on cognition. So future intervention study will be helpful to enhance cognitive function and should consider the relevance of the food component as what we just see, and also the subpopulation embed within the population. That is the three trajectory we find out. So they are actually quite heterogeneous in terms of dietary quality.
We found that in Taiwan, a vegetarian diet that is higher in vegetables, whole grains, soy, nuts and seeds, beans, with no meat and fish, and higher intake of fiber, magnesium, calcium, and lower saturated fat, cholesterol, and heme iron. This was associated with lower cardiometabolic risk factors, including glucose, cholesterol, uric acid, obesity, and blood pressure. And this may actually also be more antioxidative and anti-inflammatory. And prospectively, this was associated with a lower risk for diabetes, gout, total and ischemic stroke, cataract, insomnia, and dementia, and had an overall reduced healthcare burden and medical expenditure.
And so this is a definition that I like to use. It's actually consistent with the Cedar-Holm definition and others that are out there as well. The idea that it's an adequate intake or assimilation of energy, protein, and or micronutrients, but it has to be sustained to actually see functional change in the body. That could be cognition, it could be immunity, weakness, muscle loss, and affects capacity for recovery. A key difference between sarcopenia, for example, or cachexia, or frailty and malnutrition is it responds to refeeding. That's the key difference. When we feed someone, when they're not been fed as well, or they're having assimilation challenges, if we refeed properly, you do see improvement in malnutrition. However, of course, inflammation impacts the capacity to respond to feeding, as we well know.
The goal of the MPH is to develop algorithms that can predict individual responses to dietary patterns based on factors such as lifestyle, genetics, environment, and the microbiome. It is a large multi-site study that aims to enroll a diverse cohort of 10,000 participants from the All of Us research program. Participants report their daily diets, while a subset will also be given researcher-selected diets. These participants will do surveys and provide biological samples for analysis. Genomics and electronic health record data will be collected and analyzed. There are also plans to use artificial intelligence to analyze the vast amounts of data that would be generated from the study. It is expected that the MPH will advance precision nutrition research and enable a more customized nutritional guidance to improve health and prevent disease.
When it comes to dysphagia management, it's a real balancing act. So here, let's end at the very beginning. How do we improve nutrition and hydration with ITSE? Well, I challenge all of you to think about the consistency and the terminology that's used. Because if we can use consistent terminology and we can learn from each other, we can gather data that we can compare across the board, well, maybe at that point, we can actually produce something that we can measure more consistency in terms of intake, hydration, overall health.
The trends of worsening of weight and oral intake status were significantly correlated with the malnutrition score. The second one is that our preliminary results demonstrate interdisciplinary team care and nutritional counseling during the short time hospitalization may be beneficial to improve the malnutritional status and also progression of the food texture in post-stroke patients at the risk of dysphagia. And we also follow our patients for their NG removal rate after 3 months. And in our hospital, approximately 50 to 60% of the NG removal have been consistently observed, like every year.
Mediterranean diet is a traditional diet people eat in Mediterranean countries, and they recommended to high intake of olive oil, whole grains, fish, vegetable, fruits, red wine, and restricted to red meat or sweets. And that diet is developed by NIH and to prevent the hypertension. And that diet recommends low-fat dairy products, vegetables, whole grains, and restrict to salt, alcohol intake, and sweet foods.
Co-inflammatory diet mediates a small but statistically significant proportion of the association between poor dental function and frailty and death. Since the pro-inflammatory diet can only explain less than 10% of the association between oral health and frailty, which means it leaves that over 90% of this association can be explained by other factors. We look into literatures and try to figure out what other factors could be explain this association.
In this study, we developed a gender-specific index for survival prediction. will include the dietary pattern, food preparation, social circumstance of eating, and the body composition, especially for the social constants. This is a similar concept with a Mediterranean diet. You have enjoy your food with others, and this integrated indices can be used in the community setting to encourage older adults to have a better appetite, eating with others, more cooking, more diverse diet, maintenance of a healthy body composition.
So how we gonna explain? So maybe the results is being attributed by the consumption in plant protein, viscous fiber, and nuts. Maybe because those males participants, they do consume more food components related to the portfolio diet. So that is why we see those protective effect. So that is what we see from this study.
These studies we have find that weight change associated with high mortality risk is including weight loss or weight gain and weight fluctuation. And we also find that large weight loss associate higher mortality in the elderly with lower BMI, and the large weight gain associated with higher mortality in elderly with higher BMI.
I think single nutrition may be a weak protector. So adopting multiple health behaviors has a stronger benefit on successful aging in case of better functional ability and no frail. So I will conclude that humans are complex animals, so need to be active to live. So as it has been a long day and we sit here for a long time, actually it's not too healthy.